Well, breast cancer screening technology provider Volpara Health Technologies has just signed 2 strategic deals in the US as it moves to replicate its breast cancer screening expertise in the growing lung cancer screening market. Ralph Highnam is here for more on this. Ralph, it's lovely to have your company. Thanks for joining us.
Hi, good to be here, Holly. Thank you.
Ralph, can you just give us a bit of background about your screening expertise in the breast cancer screening sector and the reason for moving into that lung cancer screening?
Yeah, Holly, we are experts in AI for breast cancer screening, and our software is operating in around 1 in 3 breast cancer screenings now in the US, and increasingly around Australia and New Zealand as well, especially in the private sectors in Australia. So we have a huge amount of knowledge then in breast cancer screening. We have some great products or technology stack then to do patient tracking, to do computer-aided detection, to help with overall quality, and to do risk assessment and so on. And what we're trying to do now in lung cancer screening is really taking off globally. Australia, New Zealand and the US are all really starting to ramp up what they do around lung cancer screening. So we're really trying to replicate the way we save lives and cost in breast cancer over into that lung cancer screening world.
Yeah, and how significant is this deal with the US? How significant is that for you guys as a business and gaining more expertise in this area?
Yeah, the breast imaging market we estimate to be around 750 million annual recurring revenue possibility, and that's kind of globally. And we believe the lung opportunity in the US alone is around 400 million, and it's probably again double that globally. So the lung opportunity commercially is probably equal to or more than the breast cancer opportunity that's ahead of us. And although the two are very parallel, there are some interesting differences. For example, tools to help work out which women should go on for biopsy have been really hard to get commercial traction with in the US because breast biopsies are relatively easy to do. Whereas lung cancer screening biopsies are very difficult to do, and a lot of them lead to serious complications. So you really want to use AI or whatever else tools and power you've got to really help you differentiate who should go for biopsy or not. So although they're very kind of parallel, there are some key differences which make lung potentially even more commercially valuable than breast to us.
Yeah, and I mean, lung cancer causes around 130,000 deaths each year in the US alone. That's a significant amount. So what is the future in using technology to help overcome this and potentially prevent those deaths?
Yeah, obviously, Holly, that's the aim of all screening programs. And yeah, one of the amazing stats to me is if you look at the number of lung cancer cases and breast cancer cases in the US, they're about equal, but more in terms of women getting lung cancer or getting cancer. But the number of deaths, more women actually die from lung cancer than they do of breast cancer. And that's entirely related, I believe, to screening, finding those cancers earlier and getting them treated earlier. So obviously just screening programs starting up will be a huge boost, and that they are showing consistently now 20% plus reduction in mortality just by starting screening. So if you can use AI tools to improve that even further in a more cost-effective manner, then it's a win-win tool for everyone involved.
How has the Australian market been for you and working in that screening sector in regards to Australia, and how does that compare to the US market?
Yeah, the 90% of our revenue comes from the US, and that's because the US kind of has federal or state regulations about how screening should be conducted, but the individual sites have a lot of freedom to choose what tools they want to use to actually implement screening. So the US tends to be where the early adopters are. Outside the US, we've got high adoption in the private clinics in the breast world in Australia. So Imaging Associates down in Melbourne, for example, Wesley and others, Matter up in Brisbane, Spectrum in Sydney. So, and a lot of the sites around Adelaide. So we've got strong private take up, but outside the US, most screening tends to be publicly run. Breast cancer screening is very well established, very well proven to reduce deaths, and we're slowly but surely getting traction in changing for the better how they run, even so they can save even more lives at reduced cost. But the exciting thing about lung is that Australia, for example, in May this year announced it was going to spend $7 million on scoping out a lung cancer screening project. The thing then with lung is you can actually get in there right from the start to help them scope and shape out the use of AI throughout lung cancer screening. So it's a real interesting opportunity for us developing now globally, and especially in the US, but then also, as I just said, in Australia, where about 9,000 people sadly die each year of lung cancer.
Yeah, definitely. What's next for you guys in regards to your technology and moving forward? I know in Australia in particular, we've seen a lack of people actually going forward to get these screenings and get tested for certain cancers if they may be feeling unwell, because they're either afraid of going there because of the COVID-19 virus and they're just putting it off. So, or they can't get an appointment. So what's next for you guys in, I guess, helping that as well?
Yeah, we've watched how that played out in the US. So, the US went through what Australia is going through 18 months ago, basically, or a year ago. And they stopped screening for 2 years, but then they realised, as Australia will realise, that suddenly they're getting all these advanced cancers walking through the door. So you need to work out how to lock down, but also then start up screening safely. So a lot of the US sites we work with have done things like, instead of going into a waiting room where you could potentially share COVID, you arrive in a car park, you text and say, "Okay, I'm here. Let me know when I can come in," and that helps reduce the risk of cross infection. You're right the way through to, rather than people filling out or you having a shared tablet, which you get given when you walk in the door, you're now told, hey, you can actually fill out your information before you come via this web link. So there's various tricks you can do to actually get screening up and running to ensure cancer detected early without compromising safety around COVID. And I'm sure Australia's looking carefully at that at the moment.
Absolutely. Ralph, a really important conversation. Thank you so much for coming on to Ticker to speak about this.
Cool, thank you.